Back to you, Kaity.
Awesome. Thanks so much, Jimmy. So welcome everyone to Peer Support for the LGBTQ plus community. I'm Kaity Riordan. I use she, her pronouns. And I work for Mental Health and Addiction Association of Oregon, the fine organization that puts on this conference. And I am very happy to be joined today by two of my lovely co-facilitators, Rene and Aryn. If y'all want to introduce yourself, that would be cool.
Hi, I'm Rene. I use he, him pronouns. I also work for the Mental Health and Addiction Association of Oregon. So great to see you all today.
And hi, everybody. My name is Aryn Zanca. I use they, them pronouns, and I'm the youth programs manager for the Living Room for LGBTQ plus youth.
Awesome, thanks. Next slide, Rene. So just some quick disclaimers. The three of us facilitators are here today, and Jimmy. So you got the whole crew. We all identify as part of this community, which is why we're hosting this workshop. So I just want to say, please do what you need to do. If at any point you feel triggered by the information presented, we did cut down on some of the statistics. I did send out a statistics sheet with some of the heavier things that we usually talk about in this workshop. And I sent out some handouts this morning via email about 30 minutes ago, something like that. So if you want, feel free to pull those up or dive in deeper to the topic later. We have a definition sheet, microaggression tip sheet, and the statistics fact sheet. So yeah, do what you need to do if you feel triggered. I would also encourage you to push through resistance and discomfort and challenge yourself to stay engaged. And then also feel free to respectfully stop us at any point with questions. So yeah, topics of LGBTQ plus violence and mental health will be discussed. So just be cautious and understanding of the trauma that it may invoke in queer peers. So just to get a sense of who we have in the room, where was that sent? I see that to the email that you registered with. So yeah, if you registered in the past 30 minutes for this workshop, then I might have missed you, but I can send it again afterwards. But if you registered in the past few days or an hour ago, I think I captured you. So check the email that you registered with. So right now I'm just gonna go ahead and release a poll. Rene and Aryn and I decided we wanted to know a little bit more about who we're talking to. It is anonymous, just to kind of, so it should have popped up on your screen. It's just 2 questions. Are you a member of this community, and do you have experience working with this community? Just so we can get a better sense of if we're preaching to the choir or, yeah. Full disclosure, I prefer not to preach to the choir. Let's see, it should have been, yep. Thanks, Aryn. Alrighty. So if y'all could just take a second to fill out that poll, that would be great. And as I mentioned, the poll is anonymous, so that's a thing. Looks like 0 out of 22 people have voted, so please vote.
I'm seeing 22 out of 23.
22 out of 23. Okay. Well, that's even better news. I love that news. Yes, Kelly. Thanks, Aryn. All right, sweet. Oh, we got Drake. Yes. Sweet. All right, how many people do you show, Rene?
So we have so 23 out of 24 have voted. I think we just had a 24th person come on in. I'm wondering if the poll has launched for you.
I think so. Yeah, so I think Drake Eubank, you just joined. We just released a poll, just kind of asking a bit more about just who's in the room. All righty.
Well, do you want me to give you the stats so far?
Yes.
So we've got 24 out of 25, and we are 50-50 for members of the LGBTQ plus community, and 60 yes and 40 no for having experience working with the community.
Awesome. Well,
and that's what now we have 100% votes, and kind of just shifted from the 50-50 to 48 yes, 52 no as far as part of the community.
Sweet. Love that. Thank you, Rene.
Here, yeah. I guess I can share the results. There we go.
Yeah, perfect. Awesome. So good to know. Glad all of you are here. Yeah, next slide. All right. Rene or Aryn, you want to take the first couple slides of this section?
Go ahead. So kind of our first piece in all of this is to go over vocabulary. And so these are some things to keep in mind. And this will not be an exhaustive list, but you will have received a document, I believe, right, Kaity, with a little bit more thorough in terms of different vocabulary that comes up when we are talking about the LGBTQ plus community. So here's some key points on language. Language is fluid, it changes over time, and it is regionally and culturally specific. When interacting with LGBTQ plus peers, honor and reflect the language they use to refer to themselves. So we don't need to kind of reinvent the wheel or try to figure things out. Like, we can reflect what people are telling us that they are saying that they use. Slurs that have been reclaimed are in-group language and are only to be used by people who identify with the term they are reclaiming. So one thing that really comes up with this is the word queer. There is a difficult history around the word queer, and it's been reclaimed by a lot of folks within this community. However, people have different reactions to that depending on their experiences with the word, and may have some difficulty with people who are not part of that community using that language. It's just something to kind of be aware of.
Awesome. Thanks for that, Rene. And I saw that someone asked, what I'm going to do is I'm actually just going to go ahead and drop the files that I sent this morning in the chat. So you can just access them there. That way, if you registered recently, you can just pull it from the chat. So give me 1 second to do that. Okay, and last one, there's 3. Like I said, there's the vocab, the microaggression tip sheet, and then the statistics sheet. So those are all in the chat now. So just a couple key concepts to get us started. Ally, we define ally as a person who interrupts disrespectful or problematic remarks and actions of others and is willing to explore forms of bias and privilege within themselves. Ally is not a static identity, but something a person is always working on becoming. LGBTQ plus people can be allies of individuals who have different identities from them, such as a lesbian who's an ally to a trans person. And yeah, what we the phrase is, you know, ally is a verb. So it's not a static identity. Pronouns, I know that, you know, a lot of people are familiar with pronouns, but it's just important to talk about why they're so important. So pronouns are a common way that many of us refer to one another in conversation. Using someone's pronouns correctly is an important part of showing basic respect, just like using someone's correct name. While it may require you to stretch outside of your comfort zone, using respectful pronouns is a critical way you can begin to re-examine assumptions about gender, particularly those which harm trans communities. Yeah, do either of you have anything you want to say on that? It's okay if not. No, all right, next slide. All right, Rene, you want to take this?
Sure. All right, so the gender binary system, this is a culturally defined code of acceptable and expected identities and behaviors, which teaches that there are only men and women who are masculine and feminine, respectively, and that they are heterosexual. The code presumes and naturalizes this idea that there are no people who fall outside of this system. And so that system is systematically enforced in settings such as public restrooms, clothing stores, and other explicitly gendered settings. And so cisgender, this is a term that describes a person whose gender identity aligns with the sex that they were assigned at birth. It is the opposite of terms like agender, genderqueer, gender nonconforming, transgender.
Awesome, thanks so much, Rene. Yeah, just full disclosure, you know, I identify as cisgender. Part of why I was so excited to bring Rene and Aryn into this workshop is, you know, I know that they both have experiences that I don't have, and I think it's important to represent like a variety of perspectives here. So yeah, next slide. Aryn, do you want to talk about the gender galaxy? Sorry to put you on the spot, but Aryn shared this amazing diagram with us.
Yeah, I definitely can. So there's a lot of different ways that we think about, and when we're talking about gender, there's a lot of different models that we can and have used in the past. One of the ones that I really like and we've got here is the gender galaxy. So it's really a way of thinking about gender as this expansive galaxy with different planets and systems that people might kind of get drawn to. So all of the different kind of identities and things like that, they have their own little like mini solar system within this big galaxy. And it really allows for the difference in the way that somebody can be a man or a woman or non-binary. Like there's so many different ways of being. And this allows for that idea that somebody might kind of rotate around an identity, but that might look different for different people. It might even look different for them between, you know, one moment to the next. And it allows for us to think about sex and gender in these two different ways as well. So kind of pulling out sex assigned at birth and gender identity as well.
Awesome, thanks, Aryn. And can we go ahead and show the gender galaxy?
Yeah, so I probably don't want to spend too much time. I know we've got a lot in this presentation, but really quick, again, you can see sex assigned at birth, and you've got male, female, and intersex. A quick note that not all intersex folks are aware that they are intersex, depending on what the doctor chooses to do and share with parents. But that's an important part of the different ways that people can be. And I don't know, I guess, yeah, and then gender identity, you can see again, all of these different planets. So somebody might kind of rotate around a certain, you know, they might be cisgender, they might be non-binary, and within cisgender, you know, they might be a man, they might be a woman, they might be trans and a man or a woman, right? There's so many different ways of being. And so this really allows for even the change that might happen within how somebody identifies and how they understand themselves.
Awesome, thank you so much. Next slide. Yeah, Aryn, you want to keep going? Sorry to put you on the spot.
Sure. Yeah, so kind of the one of the other kind of aspects of the gender galaxy is the sexuality galaxy. So these things are different, but they're also, we are full people, so the way we experience things are not always fully pulled apart. But the sexuality galaxy is kind of along that same line. It allows for a different way of thinking about sexuality and kind of where people exist in the different possibilities of sexuality. And again, pulling apart the idea of like gender and sexuality so that we can think about who we are and how we fit into the world. And then it also pulls apart sexual and romantic orientations, which can be really helpful because not all folks who experience sexual attraction experience the same romantic attraction and vice versa.
Awesome. And if you want to do a deeper dive on that, I did just put that in the chat, the PDF on that. And it also has, just more information on that if you want to explore that. I think it also has some prompts on, figuring out what your galaxy looks like. So yeah, if we had all day, we'd go through that, but we don't. So yeah, next slide. Thank you for that, Aryn. That was awesome. Oh yeah, I missed it. Did we already look at this?
This just came up, but I think we're good to move on if we
cool.
want.
Awesome. Yeah, feel free to dive into that further. So that just, we like to go over language. We've done this workshop a number of times. It actually is part of our peer wellness specialist training. And so we've just found that, it's good to go over vocab at the beginning. So I know we went through that really fast, but yeah, we do have that handout that we sent if you want to dive into that further. So now we're going to talk about, because this is, a workshop, not just about, the queer community. I use that word because I identify with that word. So it's not just talking about like the queer community broadly, we're talking about queer peers and providing peer support to the queer community. So yeah, we're going to talk about social determinants of health for LGBTQ plus peers. Next slide. Rene, you want to take this?
Yeah. So here's some risk factors for the LGBTQ plus community, especially things to be aware of when we're working alongside this community and supporting LGBTQ peers. So there's stigma and discrimination, less social support, including loss of family support, maybe a part of their experience. We see higher rates of poverty and unemployment for the trans community. We also see greater risk of violence, particularly for undocumented and racial and ethnic minority LGBTQ plus individuals, particularly transgender women of color.
Awesome, thank you, Rene. Yeah, next slide. Just a note, so the statistics sheet has a little bit more information just on specific risk factors, statistics like how social determinants of health impact behavioral health and substance use outcomes. Will I be providing the slides after the presentation? I could do that, sure. But yeah, alrighty, so harm experienced in clinical settings. I think this one is, so if you haven't seen the documentary that we're screening as part of Peerpocalypse this year, it's fantastic. Also, if you're part of this community, it's a little bit difficult to watch. I had to pause it, but basically it's about the social justice movement of LGBTQ plus peers, like trying to get homosexuality taken out of the DSM. It was listed in the DSM as a mental illness until 1973. and what I learned from the documentary, which I'm actually going to be sitting on a panel for tonight at what time? 6 p.m., I think. Yeah, so you can join me and some of my colleagues for that tonight. The filmmakers are also going to be there, so really cool opportunity. I'd try making it if you can. I think it would be a great follow-up to this workshop. Anyway, what I learned from that is that, you know, people who were diagnosed with this were subjected to a number of things like electric shock therapy, institutionalization. They interviewed a lobotomy patient, which was really upsetting. But anyway, yeah, it was taken out of the DSM in 1973. And then similarly, the ICD, the World Health Organization listed it in the ICD until 1990. So these are all very recent developments. Another important thing to note, just in terms of harm that your peers may have experienced in clinical settings previously, and why peer support might be such an important and like valuable resource for them, is behavioral health treatment is often segregated by gender, with restrictions against trans individuals, often requiring them to have had gender affirming surgery. Unfortunately, this comes up, especially in like detox facilities, rehab, like inpatient. And then also if your peer has experience with the like criminal justice system, it comes up with that, shelters. Yeah, so I don't know if you wanted to add anything to that, Rene, but.
Yeah, I had a quick note on that. Thanks, Kaity. So I think that, well, you know, first of all, it's so important for us to talk about how homosexuality was listed in the DSM, and also talk about how gender identity disorder was also previously listed in the DSM. We see a lot of pathology, like a lot of the ways this community has been pathologized. And so I think that there is a really strong connection right there to the work we do as peers at large, in terms of the way we talk about mental health, the way we talk about substance use. And then we take in the factor that this community is also disproportionately affected by those issues as well. So really important to go over. And yes, as far as behavioral health treatment, the separation by gender is really, really difficult to navigate. And it's very complicated, because it's not always that somebody necessarily wants to, they want to have access to the programs that make them feel safe. And there's not always a clear-cut answer for that. And there's not always a clear pathway to enrolling in the kinds of whatever program that they feel safest in, whether it's a men's program or a women's program. And yeah, unfortunately, we're not seeing too much that. Also lots of people who maybe don't identify with either of those gendered categories.
Well, thanks for that, Rene. Yeah, I just want to call out something that Troy shared in the chat, which was, you know, we always talk about oppression and pain with queer folks. I'm ready to talk about joy, pride in who you become, and gender euphoria. Yeah, I think the three of us would definitely all like agree with you. I think that is a really beautiful point. Just to share like a quick little tidbit of my story. So I'm estranged from my family because they don't support my sexuality. More importantly, they don't support my marriage. I've been with my wife for 10 years, and she is a huge part of my recovery story, and just a huge part of my life, obviously. Like I've built a life with her. And so anyway, that estrangement from my biological family has had a lot of impacts on my life. But I think one of the things that I always remember my mom talking about with queer people is like, you know, oh, they're just so sad. And what I've come to realize, I'm like, Patty, they're sad because you were there and you're like really toxic and oppressive. So, you know, Like if that's the vibe you're getting, like it's because you're not trusted in like experiencing that queer joy. So yeah, that was just an aside.
Thank you for sharing that, Troy. It is such an important point, because when we are talking about this community, it's like, here are these statistics, here are the difficulties we're facing, like we need to be aware of these barriers. And it's true on the level of, especially if we're talking about training a peer workforce, we want to make sure that people are aware of the barriers that can come up. And so, that is something we explore, but you're absolutely right. Like, often we are not meeting that with the amount of like beauty and positivity, resilience that happens within this community. Like, I love the discussion on gender euphoria. So I don't think we have this definition listed here, so I'll kind of go through that really quick. So gender euphoria is the feeling you get when you are aligned with your gender identity. And it's just like this very positive feeling. So often we have this narrative, especially when we're talking about transgender people. I'm a transgender man, by the way. When we talk about trans people, it's this, you're born, feeling born in the wrong body, and how stressful and difficult that can be. And yes, the feelings of dysphoria can be extremely, extremely painful. But we often don't talk about the times in which you maybe are coming to terms with your identity, maybe making decisions and expressing yourself in a way that aligns with the way that you know yourself to be, and and the feeling of just alignment, excitement, peace, when you do that, when you're being yourself. So thank you for bringing that up, Troy. It's a hugely important thing to be covering alongside the challenges.
Awesome. Thanks for that, Rene. Next slide. I think these are the videos, right? All right, so we have two pretty short videos, just hearing from some more voices about harm experienced in clinical settings, and just things to be aware of, as Rene said, really important to be aware of when you're serving this community, experiences they may have had. So.
Sorry, it's just wheeling on me right now.
Oh, it's okay. All right, let me see if I could. Thanks for bearing with us, folks.
This is the checkers game where grandson.
Sorry. I love the point that Aryn just made about how important the choir is. We need all voices. Yes. Thank you, Aryn. Rene, I can send you here's the link, if that's helpful. Or I guess you just stop the share, huh? Okay. Well, then I will try to do it. Oh, you got it. All right. Sweet.
And so I just want a quick warning for those who are part of this community and may have experienced some harm in healthcare settings. This is a video where people within the trans community, trans umbrella, are reflecting on their experiences, and those of you who may be part of this community have potentially experienced some of this yourself. So just a quick disclaimer there. Are you hearing this? Nope. Okay, 1 second.
Oh.
Yeah?
No.
I'm so sorry. Hold on.
My name is Leo Sell, and my pronouns are they, them, their.
My name is Sophia Stanford, pronouns she, her.
I'm Gray, and my preferred pronouns are he, him.
Robin Kanauerhasa, and I use feminine pronouns, so she, her, hers.
My name is Luke Jude, and I prefer he, him pronouns.
My name is Chloe Flora. My preferred pronouns are she or they.
"99% of the time when I go to the doctor, I'm anxious and nervous.
Even though insurance and driver's license and everything says female, you really don't know what to expect.
Yeah, I don't think I know any trans person that went through the medical system and had a nice time with it. Not in this country.
I haven't gone to the dentist in 4 or 5 years because it's just such an uncomfortable experience.
I know people who, if they sprain their ankle, will just wrap it up and put some ice on it rather than going to the ER and having an x-ray done because it's just not worth the stress.
I've had a history of urinary tract infections. It was pretty commonplace for me. And I went to the urgent care, and the physician on staff that I was dealing with kept telling me over and over how atypical it was for a man to be having a series of urinary tract infections. I tried to interrupt him and say, I understand, I've been through a gender transition, so my anatomy is probably not what you expect it to be. And he kept stopping me. He wouldn't let me complete and assuring me that he did understand. And he said, I think I would like to take a look. So I pulled down my pants, and it wasn't at all what he expected. And he was immediately apologetic. He said, oh, you don't have, oh, I'm so sorry, I didn't realize. I said, I know, we tried to tell you.
I initially knew I identified and felt female around 5 years old when this was caught out by my family member who was the director of mental health for the state that I lived in, essentially required forced correction, like invasive hypnotherapy, corrective assignment and orientation to gender roles, other things to help masculinize and or reprogram the viewpoint of the world to the child. If I had to be this way, I'm gonna walk in front of a car and I'm gonna reset it and try over. That's what I thought when I was 6.
I had a bunch of different symptoms tied to sleep, tied to appetite, weight gain, mood, that had sort of increased in severity over a year. And one of the things that my doctor told me to do was check myself into a hospital next time I had my round of symptoms. So I checked into a hospital, and even just within the check-in process, I was misgendered. I finally spoke to the doctor, and he came in and was speaking to me as if I was a 13-year-old girl. And all of my symptoms were surrounding hormones. And when I started talking about hormones, this doctor in the hospital actually looked at me and said, oh, what do hormones do? I didn't think hormones did anything. And he actually checked me out of the hospital. He said, I think that you're just bleeding a lot right now. Fast forward 3 days later from this hospital visit, and I was diagnosed with invasive hormonal breast cancer that tested 99% positive for estrogen. And I think that if I had had the same list of symptoms, but was a cisgendered man, I would have been treated completely differently.
So in general, I've been blessed with a good primary care physician and an endocrinology doctor, but I was seeing a specialist for a different medical problem, and my records and everything all said female. I have everything changed. And the guy looked at it, he went through all of those steps, and then said, so do you dress full-time as a woman? And I was stunned. It's like, do you dress full-time as a man? Yes, I'm a woman. I am a woman of transgender experience. And of course, it's just like any other woman in your office.
The biggest horror story that I had was going to the pharmacy to pick up my first testosterone prescription. I was nerve-wracked already because it's like such an emotional thing to like finally get that golden ticket. It ends up being like $1. So it's just the syringes. There's no medicine. 4 people later and about 20 minutes, they finally look it up in the computer and they're like, oh yeah, oops. Throughout this entire process, I have to say my legal name, which isn't the name that I go by, out loud to the entire store. And I'm basically outing myself to everyone around me. And that's not wanting to hide, that's just about trying to stay safe. Like, some people hear that and they might follow me to my car and bash my head in.
During one physical therapy appointment, I had one of the therapists misgendered me to an entire room of people, both other physical therapists and other clients. He never looked me in the eye again. He never talked about it. He never apologized. It was just this weight. And especially me as a trans woman, I get misgendered all the time. Like, it's something I deal with on a near daily basis. So to have that happen in a medical setting, something where I can opt out of, even though it might not be the healthiest thing, I will. I'd rather protect my own sense of mental health.
Spokane County's.
Thanks for sharing that, Rene. And we have a second video to share because we do recognize that all of the people in that video were white. Their experience is really important to listen to and hear. But one of the things we like to bring attention to is that there are, intersecting identities. I got confused for a second because I was reading the subtitles and I was like, oh, wow, it's saying what I'm saying. Sorry. Anyway, Rene, can you pull up the second video?
Yeah, will do.
It's outrageous that in 2020 we have this type of policies that continue to say that the lives of trans people or the LGBTQ community do not matter.
El cuidado de salud es importantísimo. Yo no estuviera ahora viva y no estuviera manejando una agencia o liderando una agencia y proveyendo servicios a otras cientos de personas transgénero como yo si no hubiera tenido el correcto cuidado de salud.
We as trans people, and particularly trans Latina women who are immigrants, continue to experience past discrimination in many different ways.
We have to deal with rejection in all kinds of ways. We looked at strangely when you walk in the door.
Accessing healthcare as a Black person is very traumatic in this country because of like my layered identity and all the pieces of me. Like, I just don't always feel like all those pieces will be recognized and supported and affirmed.
I know I've had previous doctors that have not given me their attention, but yet was charged by the insurance company and then was not even able to answer my questions that's dealing with the transgender woman.
When I found out that I was HIV positive, I tried to seek medical care. And one of the things that I remember that I was told was that we don't treat people like you. We as trans people experience what I call the invisible discrimination.
Uno de los problemas es el idioma. Muchas personas piensan que porque hablan español, pero español no es su primer idioma, pueden traducirnos y a lo mejor no traducen en un idioma o en un castellano correcto, como es el que nosotros tenemos cuando nacemos o cuando nuestro primer idioma es el español.
You cannot have faith in your doctor and the facility that you use. How can you receive the best care?
everyone should be able to see a doctor. Everyone should be able to receive the support.
Care to me means compassion, assertion, and obviously excellence.
Realmente no somos el problema, nosotros somos la solución. Nosotros las personas transgénero no estamos pidiendo nada que otras personas no tengan.
Awesome. Thanks so much for navigating and playing that, Rene. Would you mind going back to the PowerPoint?
Hold on one second. The sound is going on mine.
Yeah, while Rene pulls that up, we have time for like maybe one or two people to share reactions. If you want to do that, you're always welcome to do that in the chat as well. Awesome. Thanks. Rene, do you want to share about this?
So social determinants of mental health for trans people. Being trans is not a mental illness, nor does it inherently make someone more susceptible to mental illness. Poor mental health in queer LGBTQ plus peers is largely due to social determinants such as discrimination, stigma, lack of acceptance, and abuse they face on an unfortunately regular basis. So really, this kind of comes to mind when we see some of the statistics that are posted in the fact sheet that Kaity had sent out a little bit earlier. When we see things like higher rates of mental health issues, higher rates of substance use issues, those kinds of things, we need to be considering not the fact that like their identity is what is causing those things, but more that the world around us is not necessarily set up to be very supportive and can lead to a lot of trauma and some of these other experiences that can exacerbate these kinds of issues that everybody can face, right?
Awesome. Thanks so much, Rene. So this is our next section, talking about microaggressions. We're going to get into some more concrete tips on how to support your peers. And there is a handout that goes with this. You don't necessarily have to like follow the handout right now, but if you want to later go back and reference it, feel free. So what are microaggressions? Next slide. Let's go, Aryn. Aryn, do you want to read this?
Yeah. So microaggressions are brief verbal, behavioral, or environmental indignities, whether intentional or unintentional, which communicate hostile, derogatory, or negative slights and insults. And they can be so pervasive and automatic with just our regular daily interactions that they might be considered innocent or harmless. But the research has shown that experiencing a microaggression can be detrimental to a person's psychological health and can lead to chronic stress, depression, anxiety, and lowered self-esteem. I think also important to note that microaggressions stack on themselves. So somebody might experience a microaggression, but that might be the 15th microaggression they've experienced that day. And so these things are cumulative. And how somebody experiences them is going to depend on so many different factors.
Definitely. Thank you for that, Aryn. Yeah, just another note on the cumulative effect, one way that you can see that comes up is, like if you, well, I think about impact over intent. Some of you may have heard that phrase, but that comes up a lot with microaggressions. Like you might not have intended to say something offensive, and it could seem like, if someone, actually go back a slide, Rene. If someone's reaction seems like disproportionate to what you said, like that's probably why. It's probably like, 15th, 20th microaggression they've experienced that day. And it's just, the one that does it. And it doesn't mean that those individuals like aren't resilient, aren't understanding. It's just, it's a lot when all of those microaggressions stack up. As Aryn shared, does anyone else want to add anything on microaggressions? It's okay if not. Well, we'll keep an eye out. Feel free to like raise your hand at any point if you want to jump in. But next slide, Rene. So some examples of microaggressions. I've put them up here, and these are also on the handout. But we have some different categories of microaggressions. One second, I'm just gonna pull up my thing really quick. But one category is, saying things like that's so gay or no homo. These things sneak into language and are like, colloquialisms, like people might say it because it's like a joke or something, but the message that communicates, if you click it, it should pull up. The message that communicates is your sexuality or gender identity are a joke. And that is a very upsetting and harmful message. Another example would be, do you have a boyfriend? Like assuming that about someone who's, like femme presenting or maybe uses she, her pronouns. Something my wife and I get a lot is like, because we're both femme, no one ever assumes that we're married. It's actually one of the reasons we got married, so we could like show people our rings and be like, we're like actually married. But people always assume we're like sisters or friends or whatever. The message that communicates is that there's one type of valid sexual identity and only two genders. So it's enforcing, heteronormativity and the gender binary. And that is really harmful. All right. Another one that comes up is, oh, you don't seem like a lesbian. It's like, well, let's unpack that. What does that mean? One of the things I started saying recently was, where did my brain go? Oh, when people talk about like straight people, heterosexual, cisgender people, talk about some people talk about having like gaydar. It's like, well, you don't have gaydar, you have bias because you actually can't visually identify people's sexuality or gender identity or like, what pronouns they use. There's no valid way to look or act like any one of these identities or experiences. So by saying you don't seem like a lesbian, the message that communicates is all queer people are the same and can be visually identified, which is not true.
This happens a lot with the transgender community as well. Like I get that all the time. I had no idea you were trans. I would have never guessed you were trans. And what this is actually messaging is it's like, oh, you can always, you'll always know if there's a trans person in the room, and all of these things that are absolutely untrue. And assuming that, you know, all trans people, you know, look a certain way.
Yeah, absolutely. I think another one that I've heard you share, Rene, is, you know, people saying something like, oh, I couldn't tell you were trans. Meaning it like a compliment or something, like, oh, you really pass as cisgender. But yeah, that's actually really harmful. Troy shared impact always matters. Looks like Drake asked, what would be a way to explain the differences in intentional versus unintentional? And how does it figure into responses? One seems to be cultural or a product of conditioned responses, and the other seems to be a manifestation of active prejudice. One seems like it's educational, and the other more like it requires a social justice perspective. Yeah, and what I would say with that is, you know, microaggressions can be intentional or unintentional. I would say, you know, intentional would be more just like outright bigotry. But yeah, microaggressions are often unintentional. And one of the things that I do when I like, you know, interrupt microaggressions, which is what we're going to talk about in a second, is I generally try to assume people's, you know, have good intentions and just aren't educated about a certain thing. And so I usually approach it more like an educational opportunity, as you mentioned, Drake. And so, yeah, impact always matters more. That is absolutely true. You center the person who has the microaggression committed against them. Yeah, and we'll talk more about that in a second. So another example of microaggressions would be people saying something like, I'm okay with you being gay, just don't talk to me about it. While my parents never said they were okay with me being gay, that was kind of like our relationship dynamic for a few years in my like early 20s, like a don't ask, don't tell situation. And, you know, that was just not really a way that I've decided that I like can't have a relationship with them like that, because my identity, my sexuality, my relationship is a huge part of my life, and I can't just omit that. You know, and especially working, I mean, family's one thing, right? But especially working with peers who are part of this community, like they're going to need to talk about it. It's going to come up. Like if you're trying to get people to open up and like build trust with people, like that is essential for helping them through their recovery. You can't tell them that something is like not up for like discussion because it makes you uncomfortable. Like you got to do this self-work to get over that, honestly, because what that communicates is your relationship is inappropriate for public conversation. And as much as I may like to sometimes, like I never tell my friends like, oh, I don't really want to hear about like your husband being inconsiderate. Like I would just rather not hear about your heterosexual problems. I may say that to my wife later, but yeah, I don't do that because it's, yeah, it's not nice. Next slide, Rene. Another thing, this is, I think, the last slide on microaggressions, but another example would be, you know, someone asking, what turned you into a lesbian? The message that communicates is that, you know, your sexuality or gender identity is disordered. One thing that I always bring up is one of my favorite movies, but I'm a cheerleader, with Natasha Lyonne, from, I think it was, when's it from? The 90s, early aughts? Yeah, something like that. Anyway, if you haven't seen it, it's fantastic. Highly recommend. Super campy, but it's basically about this girl who goes to a gay conversion camp where they try to like get to the root of like what caused you to be a lesbian, or, you know, what caused you to be gay. Anyway, it's super funny and adorable, and the queer kids come out on top. So, you know, queer joy. And then, yeah, another microaggression, especially against trans and non-binary people. Well, especially trans people. Have you had bottom surgery? Or just asking people generally about their parts. Like, what that communicates is your identity is not valid unless you have medically transitioned, which is just not true. There's a whole range of reasons why someone may or may not want that. There's access issues. Yeah. Rene or Aryn, do you want to share anything about that? Rene.
Yeah, I think that one of the things along that, whenever we're talking about asking about people's bodies, and particularly when we're talking about asking about genitalia, the fact that like when somebody may disclose that they're trans, that like that might, you know, that's the first thing we think of when we think about gender identity. But when we think about like, there's so many parts of gender, and that we cannot be like reduced. This is like kind of societal conditioning in the way we reduce gender to our parts, when it is so much more expansive than that. And so, yeah, that whole idea of like, it's your gender identity is not valid unless you've medically transitioned. And then the idea of like that is part of everybody's medical transition, when it is absolutely not. This is not something that, you know, everybody, as Kate mentioned, either like decides to do or has access to do. There's a lot of complicated things with that. And it's like, just like, you know, our bodies are just one piece of the whole, you know, ways that we express ourselves and feel aligned with ourselves.
Awesome. Thanks so much, Rene. Next slide. So these are some reasons to interrupt microaggressions when you see them happening, which, you know I see them all the time now. That's one of those things. It's like once you know, you know, you'll start seeing them more. But the reasons to interrupt them is to foster a safe environment that respects people at all times. You know, everyone does have blind spots resulting from varying experiences and knowledge. Yeah, it's important to use the opportunity to educate. And that can look like a lot of different ways. Next slide. You know, these are just some tips on how to do it. Feigning ignorance, you know, like if someone makes a homophobic joke or something, you could say like, I don't get it. You know, like, can you explain that to me? Like, I don't get it. You're going to have to explain that joke to me. So you can feign ignorance. The thing that I always go to is assuming the best, like assuming that people have, you know, like good intentions and just aren't educated. You can also, you know, personalize it. So like, you know, even if you aren't necessarily like part of the LGBTQ plus community, you can say like, oh, that makes me uncomfortable. You know, so you can take the pressure off of your peer, for example, if that's, you know, who you're defending. You can also fall back on rules and policy, like, oh, we don't use homophobic language here. Yeah, Rene or Aryn, do you have anything to add on this? It's okay if not. We have a whole handout on like tips and stuff on how to do this. So I would just definitely encourage you to look at that. Next slide. Important notes: choose your battles, consider time and place, and considering pulling the person or people aside and talking to them privately. Sometimes that's the best approach, because, you know, if you call someone out in a group setting, they might get defensive, and then it could end up causing more harm. But yeah, talking to them individually, one-on-one, you might be able to have like a more meaningful productive conversation.
Just a quick note on this as well. When we're thinking about these tactics, especially when we see things like choosing your battles and considering time and place, like this is really, we're keeping in mind like the peer work that we're doing and working with these peers. And some settings, like your peer might be uncomfortable with you challenging a microaggression for their own safety, their own comfortability. And so following their lead as far as, yeah, just kind of putting their safety first. And that's going to be something that we encourage you to have a conversation with them about. Because even though sometimes, like if you're peer supporting a queer person and they, you hear somebody use problematic language, so it can be something like you making it a calling them out on it. Hey, this makes me uncomfortable. All those things may feel like support or like the way to support your peer in that moment, but it really depends on what that peer has asked of you and it wants what they want your support to look like.
Yeah, that's a awesome points, Renee. Thank you for that. We just have a couple more slides and then I want to turn it over to Aryn. But yeah, so these are just our general like takeaway tips. Yeah, go 2 slides over actually. Yeah, perfect. So just general tips, especially for those who maybe aren't part of this community and those who are new to working with this community. If you stick with these things, and I will send the slides out afterwards so you can reference this, but if you stick with these things, generally, you won't go wrong. So don't make assumptions about people's sexuality, gender, pronouns, experiences, all those things. Just take people on their own terms. You can also, people ask this a lot, like what if someone doesn't disclose their pronouns? Or like, should I ask for pronouns? Generally, like what I recommend is just disclosing your own pronouns and then you leave the door open for people to self-disclose if they want to. Basically, it just lets them know that you are aware of pronouns and the importance of pronouns. So yeah, you can just kind of lead with that self-disclosure, which is a peer value, right? Also, we talked about this in the microaggressions section, but knowing that there's no one way to look or act like a given identity is very important. You can also ask yourself, why do I need to know? So rather than, asking invasive questions, especially about people's bodies or like medical information, like, do you need to know this, in order to help a peer access services? You might, but yeah, be understanding and flexible, also super important. It's entirely possible that, over the course of time with you working with someone, I know that peer relationships sometimes can last a really long time, a couple years or something. People's pronouns and name may change. Their understanding of their sexuality, especially as it relates to their recovery, that may shift. Yeah, so just being understanding, being flexible, sexuality, gender identity, all these things are fluid. Maybe not for everyone, but I know that's definitely my experience of it. So yeah, being flexible is important. Using respectful language at all times, super important, because what you say and do in private will come out in public, like especially at times of like high stress or whatever. So yeah, just try to be mindful of that, like in all facets of your life. One of the things that I'm definitely trying to put into practice is just never assuming someone's pronouns until I like explicitly, hear them disclose that. And yeah, that comes up constantly. So the more you can like be aware of that, the less likely you are to like, break down trust with your peer because you messed up their pronouns or whatever. Also, never outing your peer, but doing a warm handoff with permission. Like, it's important to check if a resource is accessible to your peer. And then doing your own work to unlearn your own bias, super important. Just like constantly checking in with yourself, constantly growing. You know, I know we're all generally in the recovery community, so it's just another extension of like self-work, right? And then if you take nothing else away from this presentation, which I know we're throwing a lot at you and we have a lot packed into this, it would be this sentence: if you mess up, acknowledge your mistake, move on quickly, and center the need of your peer and not your own. So especially in these relationships, don't ask. I know that like if someone microaggresses, like the reaction is to be like, oh my God, I'm so sorry, I didn't mean it like that. Like, please reassure me. Like the subtext is, please reassure me that I'm a good person. Like, oh, I have gay friends. Like, you know, I'm not a bigot. Like, no, don't do that. What you do is you say, like, if someone corrects you or something, you say thank you. And then you move on and you like try to restore, you know, like safety and trust in the situation. Yeah, Rene, do you have anything to add to that? It's okay if you don't. Nah. All right, sweet. So I wanted to give time to Aryn. Thank you, Aryn, for joining us, because there's this really cool organization that they're a part of. So this is kind of like the peer support in action. Like, what does this look like in the community and organizations that is out there doing the work? So I'll turn it over to Aryn.
Awesome, thank you. I'm excited to be here. Cool, so yeah, we'll talk about the living room for a second. And as a quick, very shameless organizational self-promote, I do know that we also have a workshop being run by one of our lovely peer support specialists and then one of our youth advisory council members. So keep an eye out for that. But the living room, we are an organization that supports LGBTQ plus youth, excuse me, primarily ages 14 through 20 in Clackamas County in Oregon. And you can go ahead and move forward, thank you. Which as a side note, if you've never, like if you've come across us before, that's a new logo and we love it so much. Yay. Okay, sorry, you can move on. Okay, so pretty briefly, the living room, we serve youth in a lot of different ways. We use a youth adult partnership model and a peer support model. So everything that we do is filtered through this lens of both peer support and working with youth and the adults in the organization for the direction that we go, for what we do, for activities, all these things. For us, that's a really important part of supporting youth and making sure that we're moving in the right direction. So we have our youth leadership. Our youth advisory council is our group of youth leaders who decide what we do, how we do it. Again, you would potentially be able to hear from one of those folks a little bit later if you wish. And then we have drop-ins. That's a space for youth to go be safe and supported. And we'll talk a little bit more about both drop-in and peer support in a second. Right now, our drop-ins are mostly virtual or fully virtual. We're hoping to be able to do some in-person, probably outdoor for a little bit activities, especially as Pride is coming up. So we're excited about that. We host events throughout the year. So we have our GSA Summit, which is either Gay Straight Alliance or Gender and Sexuality Alliance. And so that summit is kind of like a conference like this, except for it's one day and it's really geared towards LGBTQ plus youth. And we have kind of youth-led and adult-led workshops, usually a youth and an adult keynote speaker. Depending on the year, it might be virtual, it might be in person, but there's always a lot of learning, both with and from peers. And a lot of that kind of building community is a big piece of that, and kind of what that looks like for youth, and finding that joy in who they are and in their community. And oh, sorry, if you could go back for a second. Thank you. And then Alternative Prom is one of our biggest events of the year. That is kind of like a high school prom, except for it's not as specific to any high school. It's the prom that we throw. And it's really geared towards LGBTQ plus youth in a way that often proms, if that's something that you've experienced in the past, often LGBTQ plus folks are either not centered or even potentially outright like discriminated against, not allowed to bring their partner or dress to their affirmed identity. And so that's something that we created to really, again, kind of create that space and that joy. And then Pride as well, that's coming up. It's gonna look different this year, but we are excited to do some in-person activities and again, kind of bring that community together. And peer support we'll talk about, so you can move forward. Thank you. And then some really quick last wrap-ups for what we do. We have our resource closet, our gender and sexuality resource closet, which is pretty new and we're super excited about. That is free for youth in our area, and it contains a lot of different things. So you can see we've got hygiene items, we have like kind of pride items, so lots of flags. We've got gender affirming gear and like books and things like that. It's really rad. I'm very excited that we've been able to put that together. If I don't, you know, just to toot our own horn. And then we offer school support for the schools in the area as well. And community education to really focus on this specific population of folks and make sure that people have the resources that they need, both with us and then also their own knowledge so that they can support LGBTQ plus folks. So if you want to go ahead and move forward. Thank you. So we'll kind of dive into it a little bit more. So especially with COVID and the pandemic and all of that, we really started to see an increase in need in peer support. And so kind of also aligning with where our staff was growing at the time, which was really exciting. So we were able to kind of increase the peer support that we were offering in a couple of really key ways. And that is really talking about that individual and group peer support. But our drop-ins are also a place for peer support for us. The drop-ins are really designed in order to kind of foster that youth social emotional learning. And that's really all about kind of how we're in relationship with ourselves and with others and with our community. And there's lots of aspects that go into that, but it's things like self-awareness and you know, relationship skills and social awareness and how to make responsible decisions and things like that. And then we always, like we said, we always center youth in that, both in the drop-ins, in the activities, and the discussions. So it's always kind of youth-directed topics and peer support being kind of like the core of what we're doing there. And you could hear much more about that at the other workshop as well. Again, just a plug. And then for individual and group peer support, we have kind of our little mission statement there. But basically our peer support program like basically any peer support program, it draws from our own lived experiences. And we are providing support to LGBTQ plus youth in our area with whatever challenges they're facing. We know that being a young LGBTQ plus person, it can feel really isolating. And so really we're aiming to increase connection and help build that community with folks. And then we work with youth to create that space and to create space for empowerment and for personal growth as well. Yeah, thank you. So all of these things you can kind of see reflected in the mission statement for our peer support program. But I would also argue that these are all things that peer support in general is looking to do, kind of reduce that isolation, and especially like provide that emotional support for folks. So our peer support program, we have the group peer support, which is virtual at this moment. And that's kind of that space for folks to get together, and in a way that's really directed by what youth are interested in talking about, discussing, exploring, diving into those topics with each other. And then individual peer support is a little bit more geared towards that kind of individual need of those youth, kind of getting together, checking in with them to see what's going on, what they might need support with, and again, kind of working through making sure that folks are having that connection. You know, we hear a lot from youth that seeing LGBTQ plus adults is really, really valuable. Like, if you can't see yourself in the future, then how do you know what's possible? And so that's something that we are always looking to do and to increase, is that kind of visibility of what it means to be able to live as yourself and do that in a way that's safe, do that in a way that's respected by folks, and kind of imagine a future, which can be difficult sometimes. I think, yeah. So my last little bit here is kind of this idea around peer support and queerness in general. I think the peer support model is something that we use, and we use really intentionally, because you see it mirrored in the queer community and like vice versa, I would say. And so it's really all about like building that community and that connection through lived experience, which again, like that's such a peer support concept, idea, you know, and the way that these things kind of come together, especially with that nothing about us without us, like that's such a strong statement. And it's something that you see obviously in the peer movement and the peer support world, but also in the queer world. There's a really long history, and it sounds like some of that will be explored in the documentary that's happening around the queer community and the way that that has been legislated by folks who either might not really understand that harm, or they might understand that harm and might be doing it intentionally. And the same way that the peer movement really had to address the harm that was being caused by folks who, again, didn't really understand, or they did and wanted to cause that harm. And so even though, you know, not all peer support folks are queer or trans, and not all people seeking peer support are queer or trans, but I think really valuable to kind of see the way that these things intersect, and the way that, given what we know around the data, you will have LGBTQ plus peers, you will have folks needing support, and like we mentioned, due to kind of the society that we live in, and not anything intrinsic about being LGBTQ plus. And so let's see, it's a little bit of a soapbox here, but to indulge in that for a second, I think that especially this nothing about us without us is so important when we're thinking about hiring of peer support specialists. Having LGBTQ plus peers, especially LGBTQ plus peers of color, is so important because of this idea of the importance of seeing people around us who are like us, and who can share those experiences, and kind of understand what somebody might be going through, and the way that those things intersect with mental health, again, because of the society that we live in. And then I get I get really excited about this last bit. So it's it's so related, right? Like all this stuff is so related. Self-determination in the pure world is obviously so important. The right to and ability to decide what we do for ourselves, what we do for our bodies, like that stuff is so important. And the same is true for the queer community. Like this idea of being able to live in your truth as who you are. That the way that those things kind of we see in both the pure world and the queer world. It's really exciting to kind of like pull these things together. Well, I mean, I think. Anyway, and then also the idea that like with the pure world, there is such a big, vast diversity of experiences that we all experience gender and sexuality in these different ways. And so in the same way that we wouldn't assume that just because we might know a peer's diagnosis that we understand what that means for them, right? There's always that kind of idea of like, what does that mean for you? What does that look like for you? What kind of support might you need? The same is true with LGBTQ plus identities, that there's no one way of experiencing any of this. And so really, again, not assuming that we understand all the different ways that that somebody might be in their body, and being able to really have that conversation about, respectfully and if it makes sense, of course, but having that conversation of like, great, I can understand, a label that you might use, or, thank you for sharing that with me, and also like, what does that mean for you, if that's appropriate, and being able to kind of understand that there's so many different ways of being, and how that can all come together, especially as it relates to mental health. So that was a little bit of my ramble and soapbox time.
Oh, that was awesome. Thank you so much for sharing about that, Aryn. And yes, we can send out the chat, the private messages, and the messages that were intended to be private will be deleted. So that's that. Just wanted to note that. So yeah, we have like 5 minutes for some questions and reactions and stuff. But yeah, thank you so much, Aryn, for sharing about that. Yeah, Drake.
I'm not sure I want to go first, but I had a couple questions around advocacy. Mental health advocacy has been around for a little while, and it started out essentially as human rights based. There were identity issues within that, and the freedom of your own mind. And I've noticed over the course of having interactions with the trans community and watching how the advocacy works, it seems like there are some ways that it works slightly differently. There's like, this is just an example of a conversation. I was mentioning basically in the context of the larger discrimination of the society. Like the first thing I was going to say here as a joke was, I have friends that are mental health patients because that's essentially, the overarching identification of the conference is around people in the system. And when I mentioned that people, and this is sort of funny, that people would be happy in many cases to just be considered human, people that have been given pejorative diagnoses and pretty predacious kinds of labels. The answer I got back was, that's not a pronoun, which is like that. There's a finer point in all of that. So, and the other question I had was around self-representation. The Justin Dart quote you brought up, nothing about us without us. If people in the mental health advocacy movement have traditionally asked for their own voices to be heard and be able to speak in their own voices, and part of that engagement is what actually gives you know, like people telling their stories and people discovering that they are in fact real human beings. When those kinds of explanations are humanized, that actually serves to gain the understanding and frees people from a lot of stigma. Sometimes though, the answer in the trans community, and it's a phrase I heard here, you know, where people should just go work, you know, they have some work to do on their biases and should just go take care of that, and then we'll have a conversation later. And I'm just curious about if there's some dynamic there that somehow encompass both, because the predisposition, I think, for the advocacy movement for mental health is that you represent yourself. And it seems like some of the questions and the educational moments are either so personal or so complicated for the trans community that you can't really necessarily always do that, or that I have people that say, I'm tired of trying to explain this, and people just really don't get it. So I just tell them to go figure it out. And the one last thing I wanted to bring up is that's enough. I appreciate the chance to speak. Thanks.
Yeah, no, that was a great point. Thank you, Drake, for sharing. Yeah, what I would say is it's okay to like allow people in the community to educate you when they are willing to offer that emotional labor, because it is emotional labor. And so like with peers, you know, you might not want to like demand that emotional labor from your peer, but maybe you have friends or colleagues who are comfortable and have expressed that they're comfortable educating you. So seek out, find those people. I don't know if you have anything you wanted to add, Rene or Aryn.
Yeah, fantastic question. I think that's a really interesting point to be bringing up, because we do want to be getting our information from the source, and yet we don't want to be asking people to share parts, you know, things that they're not comfortable sharing with us. And so like coming to a space like this is exactly kind of like the venue. Like, how can we, if we're interested in learning more about this community, or we know that we need to do, like, we know that we have more work to do ourselves in learning more about this community, because it's going to impact our work, going out of our way to be in opportunities that can facilitate learning, such as right here. So again, it's always that, there's always that kind of consent piece. We want to make sure that we are getting our information from somebody who has said that they are willing to share it with us.
Awesome. Cool.
Yeah,
thanks. So I see, oh, go ahead.
Sorry, I was just gonna say really quick. Yeah, I think that balance between kind of self-education and hearing from like the voices of lived experience, it's tricky, but I also think that there's a really good opportunity to be seeking out those voices even when doing the self-education, and that there are so many different ways that folks have shared those experiences, and especially because they are so different and so personal, that we're always like learning, you know, even folks in the community, like I'm always looking for more perspectives. I'm always looking for different experiences. And folks have shared those in so many different ways, whether that's on YouTube or it's in articles or it's, you know, in presentations or it's in, you know, there's so many different ways, books and, you know, movies, all these things, that I think it's such a balance between, hearing from the source in the moment, and also hearing from the source outside of that moment.
Awesome point. Thank you so much, Aryn. So I do see that we're right at time, but I also see hands up from Amy and Stephen. So I just want to say, you know, thank you everyone so much for joining us. I know that I have, you know, some time to stay on and answer any last questions. Rene and Aryn, do you have time to stay on? All right, sweet. So yeah, we'll take the last questions. If you need to leave, feel free. But yeah, Amy.
Thanks, Katie. So I just want to say thank you again for words when they're put in that makes sense to me at this point in my relationship with my peer and my peer's family. So the words you use, rotating around identity, you know, that it is fluid, and in particular, as you know, in my peer's family, this is, you know, a teen. And so it really makes a lot of sense to me, and it gives me words that when I, not just within my peers, but within my whole entire work group. So thank you.
Awesome. So glad to hear that. Glad you're here, Amy. And I'm glad your peer has you. I love your peer. I thought the team was fantastic.
It's just been an amazing journey for me. Just,
love that. All right. And then I think it was Stephen next, and then Daniel.
Hi, my name is Stephen, and it's them, they. And I wanted to say that I've been in the gay community for 55 plus years, and it's the senior community. The gay community is kind of a forgotten community, and I would like to learn how to reach out to that community. If you have any resources that you could post or send.
That's a great point. Yeah, thank you so much. I will connect with some people, and Aryn and Rene and I will put our heads together, and we'll get back to you on that.
Thank you.
Yeah, that's awesome. Thanks.
Yeah, I really appreciate your consideration with this part of the community. It's hugely important in our broader conversation. We talk a little bit about this, but it's really important to have specific resources that address this community that has had some different experiences than the community growing up today.
Yeah,
Thank you.
definitely. Thanks. And Daniel.
So I got my start in the peer world back in '95 in the community, and I now work in the houseless population. And I just have so much gratitude for all of you to step forward and continue to take care of our community. So thank you.
It is our pleasure. I will speak. I don't want to speak for this, but I know that it's my pleasure.
Oh, definitely. Yeah, absolutely. Awesome. Thank you everyone for staying on a little bit later to answer those questions. I'll be sending out a follow-up email and I'll include my contact information if you think of anything else you want to ask. And yeah, I will send the edited version of the chat out also. So yeah, thank you so much, everyone.
Thank you.
Thanks, Rene. Thanks, Aryn.
Thank you.